trusted name when it comes to physical therapy is definitely KORT. You are aware of what they do, but they do so much more than maybe you are aware of. Kentucky Orthopedic Rehab Team with KORT now is Teresa Smith. Teresa, welcome to the show.
Hi, thanks for having me.
Okay, sometimes it's tough for people to talk about problems in the pelvic region, and that's what we're talking about today. It's pelvic floor physical therapy. Okay. So before we get into it, exactly what kind of issues are we talking about, Teresa?
So pelvic floor physical therapy deals with urinary incontinence, bowel incontinence, erectile dysfunction, pain with sexual intercourse, pelvic organ prolapse, even bedwetting for kids. It can deal with a lot of issues.
Okay, so is this due to a weakness in the pelvic area, or is some of these therapies just able to help the situation? Talk a little bit about exactly what this pelvic floor plan can do.
Yeah, so most people have heard of a Kegel, right? Where they're squeezing and trying to stop the flow of urine. Pelvic floor physical therapy is so much more than that. Occasionally, people do need to do Kegels, and we can teach them how to do it the correct way, because at least half of the time they're not doing it correctly. Or if they haven't improved from doing them, then maybe that's not really what they need. It's not always about a weakness. Sometimes it's about relaxing those muscles. Sometimes it's about more pelvic pain in that area, and so we need to help them to relax their muscles so that they can get back to doing what they want to do.
So you talked about a list of issues that people may have that this therapy could help them with. So what are some of the signs? Perhaps somebody who's watching right now go, yeah, she mentioned something, maybe me. So maybe there's other folks out there who go, I don't think I'm there yet. So what are some of the signs that you may need this type of therapy?
Yeah, so leaking urine if you cough, laugh, or sneeze. Maybe you don't go anywhere unless you know exactly where all the bathrooms are on your way there and when you're there, and you're kind of scared to go out because you're not really sure you're going to make it on time. Sometimes it's even leaking stool, or not making it to have a bowel movement, or chronic constipation, or erectile dysfunction, pain with intercourse, or even sometimes low back pain. Low back pain can be related to pelvic floor dysfunction. Maybe sometimes they're having problems with urination or bowel movements, but they haven't really connected it to that low back or hip pain.
So, Teresa, if you would, let's talk a little bit about what these sessions are like, what someone can expect. What kind of exercises do you perform? And then also maybe give us a little bit of window on when we can start seeing some improvement.
Yeah, so the first session really is about listening. We want to gather as much information as we can to kind of build a story, learn the patient's story and see what their journey was. A lot of times people suffer for 5 or more years before they even get help or before they learn about physical therapy. So we want to see what their goals are and see what kind of things make their symptoms worse. And, we're going to talk to them about what they're eating, what they're drinking. All of those things really affect pelvic floor physical therapy. So from that, then, we can kind of gather a plan together, make a plan about what they're not able to do and what they'd like to be able to do. So occasionally that is strengthening exercises, either for the pelvic floor or surrounding areas, hip muscles, or, strengthening the core, if you will. But sometimes it's about relaxation and managing stress and changing the things that they're drinking or eating or things like that.
See, what you said makes perfect sense to me, Teresa, because it's like this is a very personal issue, so the therapy is going to be very personal and fit you as a person with KORT. I like this. Okay, now let's talk a little bit about, I mentioned with Dr. Sweeney, audiologist, about testimonials. So you're able to see people who have benefited from this type of therapy. What do you hear from them? What do they say is the thing that they improved in most?
That's my favorite part about being a physical therapist is being able to help people get back to whatever it is that they want to do. So occasionally, we have people who are really affected by their incontinence. They don't want to go out. They don't want to do anything. They don't want to go to the trampoline park with their kids or things like that. And so we've been able to help a lot of people get back to just living their normal life without without leaking, for example.
That's what it's all about. And I think sometimes we always think, okay, this is a part of aging, but that's what's great about, I found about physical therapy, is you guys are doing so many exciting things. I mean, honestly, there are people avoiding surgeries that were as little as 5 years ago, it had been a surgical matter. Now it's like, no, we can rehab you back to health. So I know we've talked a lot about this pelvic plan, but with that being said, you guys do so much more. For those out there who maybe have a hip problem, a knee problem, and they think, you know what, I've got to go to surgery, I'm going to delay that as long as I can and procrastinate. Therapy can help.
Absolutely.
Hugely. I mean, it's amazing. I talked to some people. I had my knees done, meniscus. And the only reason I throw this out is I'm talking to people now who said, you didn't have to have that done, and they're 100% doing better than I am and didn't go through surgery.
Right.
That happens.
Absolutely.
You're smiling because you see it.
Yes, I see it every day.
Wow.
Yeah, absolutely.
Okay, so for someone who would like an appointment, maybe they're having some of the issues, some of the challenges that you talked about, Teresa. Okay, what's the process? How long does it take to get in? How does it work?
Yeah, so we have over 30 locations that treat pelvic health across Kentuckiana, and so you can call the 1-800-645-KORT. That's our centralized location, and they'll get you set up for a location that's closest to you. Typically, we can get you in, depending on location and time of day that you want. Typically, we can get you in that week, which is a lot sooner than than most people can. So
yeah,
that's
you guys,
great.
you've got play all over the city. I've seen you're all over the place. So that's the great thing about KORT, about it being established and having a number of venues. If it's close, it always helps. I have to ask you, okay, it's that time of year. A lot of folks are trying to jump back into the old physical training kind of thing. I would imagine you're seeing a lot of people because recommendations from you. Don't go too fast, right? Slow it down a little bit, right?
Yeah, ease into it.
Yeah,
That's
there
right.
you go.
That's right. Ease into it so you can stay out of our office for as long as you need to.
Yeah, you guys, I would assume, are very, very busy.
Yeah.
Yeah.
Yep.
So, okay, once again, KORT, Kentucky Orthopedic Rehab Team. They've been doing it for years. There's a location near you. If some of the issues that Teresa talked about, some of the challenges, maybe you're saying, you know what, I live that. Do something about it today. There's the number right there. These therapies can help you and those that you love as well. Teresa, thank you for your time. Really appreciate it.
Thank you very much for having me.
All right. Coming up here on Wave 3 Listens, we're going to talk about free high school education.